is the ADIR used for autism diagnosis? Imagine trying to piece together a puzzle without seeing the full picture. That's what diagnosing autism can feel like, especially when relying on different pieces of information. The Autism Diagnostic Interview Revised, or ADIR, is one of those key pieces that helps clinicians see the bigger picture clearly. It's a structured interview, meaning it follows a set pattern, and it's semi-standardized, so trained professionals ask specific questions but can also adapt based on responses. The interview is usually with the parents or primary caregivers of the person being assessed. The main goal of the ADIR is to gather detailed information about the individual's early development and current behaviors. It focuses on 3 core areas that are essential to understanding autism. The first is language and communication skills. This includes questions about how the person talks, understands language, and uses gestures or facial expressions. The second is social interactions, like how they relate to others, share interests, or respond to social cues. The third area covers restricted, repetitive, and stereotyped behaviors, such as repetitive movements, intense interests, or routines. The interview has about 93 questions divided into sections. These sections cover early developmental milestones, language growth, social behaviors, and specific behaviors like aggression or self-injury. The clinician or researcher asks caregivers detailed questions about behaviors both from early childhood and now. This helps paint a full picture of how the individual has developed over time. The ADIR is generally used for children aged 4 years and older, especially when their mental age is at least 18 months. It's often combined with other tools like the Autism Diagnostic Observation Schedule, which involves direct interaction with the individual. But the ADIR relies on caregiver recall, which is vital because many autism symptoms appear early in life and can change as a person grows. Once the interview is complete, the answers are scored using a standardized algorithm. This scoring helps determine if the behaviors and developmental history align with autism. It looks at the 3 main areas and compares responses to established thresholds. If the scores meet the criteria, it supports a diagnosis of autism. The ADIR is helpful because it provides a detailed developmental profile from the caregiver's perspective. It helps identify patterns typical of autism and distinguish it from other developmental issues. The information it gathers also guides treatment, planning, and educational support by highlighting strengths and challenges. It's important to remember that the ADIR isn't used alone. Clinicians combine its results with their observations, other assessments, and clinical judgment. This comprehensive approach ensures the diagnosis is accurate and the person gets the support they need. In essence, the ADIR is a powerful tool that captures the story of a person's development through the eyes of those who know them best. It helps clinicians piece together the early signs and current behaviors to make a well-informed diagnosis of autism.